Hi, I'm Nichola. I'm the Cardiac Specialist Physiotherapist for MY Therapy Community Rehabilitation. I came into physio following 3 years of study at Sheffield Hallam University, followed straight from A-levels. Did A-levels in biology, PE and geography, which gave me then good stead for starting my career in physiotherapy. Over my time at university, I tried lots and lots of different areas as a student, and then from there secured a job within Doncaster Royal Infirmary. I did band 5 rotations at Doncaster, and then from there, luckily after about 20 months of band 5 rotations, I then qualified and specialised in cardiac rehabilitation. So what is cardiac rehabilitation? Cardiac rehab, we see people, as the name suggests, who have had cardiac problems, your heart being at the centre of that. We see people in gyms, we see people in their own home environments and give them what they need to return to a normal way of life. This can be anything. It can be as much as giving them some real basic strength-based exercises just to be able to get into the kitchen, or it could be someone who's wanting to return to windsurfing. So it really is the opposite ends of the spectrum with patients. We have young people, we have old people, so we see people anywhere from the age of 20 up to the age of 100 and anything in between that, so it really just does depend on who needs our help. People who we see could have had heart attacks, they might have had bypass surgery, they might have had stents fitted, and all these need some kind of advice and education following. It's really important that these people get that advice so as not to cause any further problems later on down the line. From a physical activity point of view, that isn't just the thing that we have to concentrate on. The holistic approach to the patient is really important, and that's what's so brilliant about physiotherapy, because we have that time and options to spend with the patient to make sure that we're covering all those options. We look at medications, we would look at physical activity, we would look at helping support with diet, psychology. So if people are struggling with anxiety following a heart problem, then that's really important that we get on top of that with the help of other professionals so a patient can then engage in the therapy that they need. It is so rewarding. We see people on a day-to-day basis and we can see real significant changes from one week to the next. And for me, that is a great part of the job. You may have somebody straight after surgery who is struggling getting out of a chair, and within 2 or 3 weeks we've got them walking up and down the street. It can be as simple as those little changes, but it makes a real difference to a person's way of life, not just for them but for their families as well. We work tirelessly and endlessly with the multidisciplinary team, and that's a really important part of the job as well. So it's not just thinking about us as clinicians on our own, but in terms of following a career in physiotherapy, I would say yes, go for it. It's so rewarding and you get so much out of it from a career progression.